When someone asks me who is a good candidate for a penile implant as one of their solutions for erectile dysfunction, that's a very personal conversation you have to have with your urologist. Sometimes it's people that just don't want to take a pill for the rest of their life, or maybe need more spontaneity when it's time for a sexual encounter. Those are some people that would be great candidates for a penile implant. Most people are surprised to find that their penile implant surgery is actually covered by their insurance. It's covered by Medicare and almost all commercial carriers. So be sure and talk to your urologist to see if your insurance covers that procedure. When it comes to penile implants, there are actually a couple of different models and types, and they are all available in our practice here in Texas. The two main types of penile implants are malleable and inflatable. With the malleable implant, that one is always semi-erect. It's never fully erect, but it's never fully flaccid or soft. With the inflatable implant, you have the option of inflating it all the way to a very rigid state of being, or deflating it all the way to where it is very flaccid or soft. Patients commonly ask, how do I determine what size implant they get? Actually, that's sized in the operating room at the time of surgery. We always select the largest implant that your body can accommodate. That seems to work out the best. If you have chosen an inflatable penile prosthesis as your implant, operating that implant is very simple. I place a small pump in your scrotum that is concealed, and when you want the erection, you simply pump the pump, and to make the erection go away, there's a small release button that accomplishes that. One of the most common questions I get is, how are my orgasms going to be? Or am I going to be able to have ejaculation or even sensation? And the answer to those depends upon sometimes why you're needing the implant in the first place. Many guys have had their prostates removed because of cancer. In that case, there will be no ejaculation. However, in all cases, there's still exceptional sensation and the feeling of orgasm. If your prostate is intact, you will also have an ejaculation most likely. A lot of guys are worried that people are going to know that they have an implant, and I always tell them, the only people that know you have an implant are the people that you want to know. Everything in an implant is concealed. It's inside your body. It can't be detected unless, like I said, you want them to know. When the patients ask what the implants are made of, I do assure them that these implants are very durable. They're made of a material that's very soft and natural when the erection is down, but very firm and strong when the erection is there. The inflatable implants are filled with a solution so they can get hard or they can go soft. That solution is saline. So if there ever is a defect in the implant at all and the saline were to leak out, it wouldn't harm you at all. The procedure to implant the prosthesis is actually pretty straightforward. It is done in the operating room where the patient is very comfortable with general anesthetic. I make one small incision above the penis, and that's the only incision I make. Through that incision, I choose the correct size implant for the patient, place the implant, and then close the incision. The procedure takes about 30 minutes to an hour. The recovery period is different for each patient. It's usually between 1 and 3 weeks. During that time period, there may be some swelling, there might be some bruising, and that's where those symptoms all go away and the patient gets familiar with their implant. After the implant surgery, everyone's very eager to get out there and use their new implant. It does take a few weeks of healing, and that's going to vary as well. So probably anywhere from 2 to 4 weeks is the standard amount of time, but that will be between you and your urologist. The penile implant is a mechanical device, so it's not unreasonable to realize that there may be some parts that need to be changed or fixed from time to time. However, these implants are durable and they last for many, many years. So much that the company actually puts a lifetime warranty on the implant itself. In general, if we get 10 years out of one implant, we're pretty happy with that. When we talk about the success of the penile implants for the patients, we often talk about that in terms of satisfaction rates. And the satisfaction rates for the penile implant are in the high 90s. It is interesting that the patient's satisfaction rate is almost as high as the partner's satisfaction rate. Whenever we discuss any surgery with a patient, we have to include risks and benefits. The main risk of the penile implant surgery is infection. Other risks could include discomfort or just not satisfied with the way the implant works. These are all discussed prior to going into the surgery for your penile implant.